The CARES Act is a federal stimulus package that has a lot of components to it, but most importantly for us in St. Louis County is the component that is directed toward local government. And we have very specific direction that comes with this stimulus package, with this funding, and that direction is to spend it only on COVID-19 expenses, on things that weren't in our budget for 2020, and that we must spend it by the end of the year or give it back. So my hope and my plan is to work with our community and other elected officials to identify the needs based on the three crises that we're facing: a public health crisis, a humanitarian crisis, and an economic crisis. And then we're currently waiting for the federal government to promulgate rules that will give us closer direction on how exactly we can distribute those funds and the compliance program that will be required, because we know that if we don't use them as the federal government has required us and instructed us, then the Inspector General will be watching us, and we will have to return any funds that aren't spent appropriately by the regulations on COVID-19 related expenses. It's obvious to us that COVID-19 expenses would be testing, overtime for first responders, personal protective equipment, providing services, health care to people who are isolated because of COVID-19. We have contracts with hotels already to allow first responders to remain in isolation and not return to their families once they've tested positive or they've been exposed, because we don't want their families to be infected as well. We know that in some cases isolation away from your family is important, because 70 to 80% of the transmission of COVID-19 in our community is done from close family members that you live with. I believe the money will arrive on April 24th, and that will be sequestered in the bank. We will set up a compliance program to make sure that when it is offered and spent, that it's appropriate with federal regulations, because it's like any grant program. If it's not spent according to its federal guidelines, it will have to be returned, and we don't want to be in the position of returning any part of up to the $175 million that our community is eligible for. But we also have to move promptly. That is a stimulus money, it is rescue money, and we want to get it in the community to start helping people as soon as possible, because our community has been devastated from a public health standpoint. The loss of life is overwhelming, and the economic devastation is incredible, and we need to move quickly to get our community moving again forward. The legislation that I've requested includes a transparency portal, and expenditures will be updated on that portal as promptly as possible. So anyone who has access to a computer can, from the comfort of their home, look at that portal and follow right along as we're spending the money to rescue our community from this tragic event. We're eligible for reimbursement from some of the funds we've already spent, which is important, because the county has already spent quite a bit on personal protective equipment and testing and resources and contracts with hotels for quarantines and isolation of infected individuals. And all of that wasn't budgeted and wasn't part of our budget, and would be a terrible expense for us to have to absorb, especially when our revenues are declining. Sales tax is going to be absent or severely impaired for a large part of this year. And our revenues are going to be cut significantly. So increasing expenses along with revenue shortfalls will make a very difficult budget year for us. And that was part of the purpose of this federal program, to try and cover some of those expenses that we've already had to apply in this emergency response. I have to sign an official request that will allow the federal government to deliver that funding to a bank here in St. Louis County that the St. Louis County government can have access to, as long as the receipts we're turning into this emergency fund is related to the COVID-19 response and is consistent with the federal rules that require and align on how it's being spent.